Now, this something which I think it's worthwhile knowing, and is what we call culture-bound syndrome. Now, culture-bound syndrome is an amalgamation, of psychiatric and also what we call somatic disorders, bodily symptoms anyway. And you can identify it in certain countries, in most countries, it's universal in some ways anyway. And sometimes they call it folk illnesses, which alteration of the behavior and experience, tend to figure prominently anyway. And actually, many of these syndromes, are not syndromes at all anyway. They're basically local ways of explaining, particular cultural, or problems anyway. So the concept of culture-bound syndromes was adopted in, the DSM-4 anyway. But DSM-5, the criteria to reflect cross-cultural variation in presentations. And in fact, they give more details about the culture. For example, you have evil eye, you have, they call it 𝐁𝐻. So same thing you find, you find that in different countries, they have similar things anyway. Something called Ataque, Amok, and in Malaysia, and Dhat in India, and falling out, blackout, like epilepsy type, ghost sickness. All these are found in different countries. I call it culture-bound syndrome anyway. So in fact, sometimes possession, are seen or perceived by some commentators as a culture-bound syndrome anyway. But others argue that although the manifestation may be different, according to culture, the underlying theme is always the same anyway. So it's worth looking at it if you have time anyway.